I'm still marveling at really the number of us who have come together to talk about data and the work that we do in our program. So the Open Data Portal and the Open Data Program, and just wanted to provide some quick updates, because in many ways it really was sort of a foundational initiative for Health and Human Services. We actually launched the portal 5 years ago out of the Department of Public Health, and then onboarded each department across CHHS to really focus on a one-stop shop for Health and Human Services data. The program continues to go very, very strong. We have over 350 data sets from across all of our departments published and continue to publish more. And we're excited to continue that program into the future and see more and more of our departments continue to make that commitment to data transparency. Any questions on that, again, you can contact the team at opendata at chhs.ca.gov. And again, we have a collaborative team across departments that works on the platform.
We have data coordinators in each of the departments, and those data coordinators are there to help you get you through the process. They clear out any barriers there are. They can track how it's coming along as you progress through the process. There's two pieces to the process. There's the Interagency Data Exchange Agreement, or the IDEA, that was signed on May 12th, 2016. It's been out there for over 3 years. And also the BUCP. So the first part, the IDEA, gets all the legal stuff out of the way, or at least most of it. And then you're left with the pure program and data needs, and it puts it together into a document called a Business Use Case Proposal, or BUCP. And that collects all the use case details. It collects the contacts that are program contacts and data contacts, technical contacts, how you're going to transfer the data, how you're going to destroy the data, all the aspects, data element list, everything that you need to be able to provide the data from one department to another and make sure that that data is being protected.
So I want to talk for a moment about how we're expanding the use of the intra-agency data exchange agreement that Health and Human Services developed and moving it outside of Health and Human Services to other agencies. There's an effort out of the governor's office to take Health and Human Services legal framework and expand it to multiple agencies within the administration. So we are actually drafting that language now, and this is a very exciting opportunity to move integrated healthcare and social services forward throughout the state of California. So what is the DDG and why should we use it? The DDG establishes an agency-wide policy and process for the public release of confidential information. It ensures that we are in compliance with HIPAA and the Information Practices Act, and we're in compliance with the documentation requirements of HIPAA. It ensures that the information of individuals is not exposed, but that we can still use that information. And it promotes the release and the use of information that would otherwise be kept private.
One of the biggest efforts that we're also working on right now, and when I say we, I mean CHHS, is an effort to build out a research data hub. Of course, the Open Data Portal was a tremendous kind of innovation and first step for the state of California to be able to put out public data for individuals and consumers and clients and stakeholders to access. The vision for the Research Data Hub will be that this will be the home where we will be able to host non-public, confidential data in a very secure and integrated fashion so that it can be used for research and evaluation purposes. And so the assumption going into this project is, as we move forward with more person-centered, client-centered programs and a focus, that we need kind of that integrated data to drive program improvements and to advance policies that reflect that whole person. The goal, and we are deep underway, is to have a fully operational research data hub within the next year that can be used to advance new knowledge and will promote operational improvements.